And we have about 10 minutes or so, maybe 15 minutes before lunch. Can we have a few questions? I was told there was one particular question to be asked from the last session, from the lady in red. Okay. So have we got 2 or 3 questions first? There's one here, 2, 3, 4, 5. Yes, I think.
Thanks, everyone. Couch Simon Peter is my name. I work with African Fraternity for Justice, Peace and Development. My contribution go directly to Honorable Justice David. Thanks so much for your presentation. But my concern tackles typically Uganda as a country. You said, and it's indeed true, that the Constitution of the Republic of Uganda is the most gender sensitive in Africa. But what you found in our practice at the ground, the problem of all this is the ignorance. Generally, people really don't know what they are doing. Come back to the side of the law. As you said, even some of the parliamentarians are there, but still they don't know what's embedded in the Constitution. It's a constitutional provision that the government has the responsibility to disseminate this Constitution into our local languages. Uganda has got over 52 different languages spoken, but our Constitution is typically in English. This leaves the biggest population of the country ignorant. They don't know what the Constitution says. We are discussing this, but the mass we are targeting, they are still kept under ignorance. I don't know how we are going to do this, because it's the responsibility of the country, the responsibility of the government to do this, but I think through such forums, we can foster it to do for the betterment and to help us in what we are doing. Thanks so much.
Thank you.
Thank you for the presentations. I'm Lilian Pavlunja. I work for Care International in Uganda. My question goes to Justice Batema. We appreciate the work that you're doing in trying to improve the justice system. My concern, however, is in relation to the cases of sexual violence being taken as capital offenses. And however, when you go to the Director of Public Prosecution, not only in Uganda, but also Burundi, Rwanda, it's a similar situation. This case, there's a serious backlog in these cases. For instance, we have over 15,000 cases last year, and they have not been handled, or they are under prosecution, as you say it, and they say the witnesses are not available. Is there a possibility for establishment of an independent court to handle such cases? Or is there a penalty in case the judiciary or the magistrates don't handle these cases, being considered that they are not a priority then? And then what is the cost of handling one case? Because usually when we talk to the people in the justice system, we are always told it's very expensive. So when is this expense going to end so that we know that these cases can be handled and we conclude them? Thank you.
Thank you. We have a question over here.
Thank you very much for very great presentations. Mine goes directly to Dr. Olive Sentumbwe. It's maybe a comment more than a question. Talking about funding and budgeting, I think we need to walk away from expecting actors, governments to put aside money for gender and gender-based violence, because frankly, most likely it will not happen. I think we should begin looking at the opportunities with other programs to look at how we can use, for instance, health budgets elsewhere to make sure that this work is done by doing things like looking at data, working together. For instance, if you're in the HIV world, how can you look at PMTCT programs to ensure that some of this work is done? That way, at the end of the day, IPV will be dealt with without actually saying we need to have money put aside.
Again, the question here, and then we'll go over here.
Thank you, presenters. I'm Jean from Raising Voices. My question, ironically, is maybe answered or not by the previous question, because I was observing that we have policies, laws, mechanisms like CASA. However, we don't have much being done, and one of the things that Dr. Sentumbwe pointed out was budget, which is a chronic problem. So I was wondering if the panelists could give recommendations on how we could move beyond lip service to action, beyond all these policies, all these mechanisms. How do we move beyond that to action?
Okay, I have 1, 2, 3, 4 more questions, then we'll have to stop there. So we take the 2 over here and then the 2 questions here.
Okay.
Yeah.
Thank you very much for your presentations. Justice Batema, I'd like to know what is the progress in terms of institutionalizing this training on gender and women's rights, pre-service, in-service, for both magistrates and judges. And then also, are we beginning to get a critical mass of judges and magistrates who are willing to make decisions that go beyond the training, you know, the training they got at law school? Are we beginning to get a critical mass of judicial activists?
Thank you very much. My name is Mary Kabaru from Kenya, from the Ministry of Devolution and Planning. First, mine are just comments. First, to the Honorable Justice. I think in Kenya also we have one of the best constitutions in terms of guarding the gender equality for women. And we also have the mechanism on alternative dispute resolution mechanism, the ADRM. And of course it's being used, but we're also saying we need to be careful that it doesn't work against women and that it should be able to reflect the spirit of the Constitution, although it's a very good thing. That is just a comment. The other one is on the issue of budgeting. I think the other speaker had said that we don't need to put specific resources for gender equality work, including what we are discussing here, IPV. But I think I have a different opinion, going by what has been discussed, I think, from yesterday, that really there's an opportunity here. There's the issue of the costing of GBV. And one of the things we are doing as Kenya is to do a costing for GBV work, to see the kind of impact it has on the economy of Kenya. And we are saying once we're able to do that, we should be able to convince our policymakers to see the need of investing on work on GBV, because that way it would also help us take the appropriate measures to prevent GBV, rather than reacting and spending so much in terms of managing GBV. I think I want to look at it differently. For example, in our country, we've made a small victory in terms of engaging our policymakers. Right now, the government, for the first time, has put aside some money to address GBV, and this is through the enactment of the FGM Act in 2011, and of course, and around the advocacy work that had gone around that, which made the policymakers, including the executive, see that we need to put some funding to be able to implement the policies, including the legislations in place, because we are saying we have policies, we have legislation, but implementation is an issue here. So really we have to work to see that the right resources are put for the implementation of these policies. So we have an opportunity through such studies. Thank you.
Thank you. And we have 2 questions over here.
I work with survivors of SGBV. My concern goes to Honorable Justice Batema. Honorable Justice, I have heard that survivors of rape give evidence in open court. So we've always left ourselves wondering and asking ourselves that, does the law exist really to help survivors, or does the law work against survivors? Because cases of survivors of rape that we've received, when they hear that they are going to they are very quick when it comes to getting forensic examination, trying to seek legal redress, but once they hear the bit that they are going to give evidence in open court, then they shy away from the whole justice system. I'd like to hear what you say on that.
Catherine Githai from Men Engage Kenya Network. Thank you to all the presentations made by the presenters. Firstly, is a comment to second what Mary from the Gender Directorate of Kenya has said. We should all appreciate the efforts made by donors in terms of giving funding to these critical issues, but they do so in a bid to help the government. And therefore, the responsibility rests with the government, and therefore, in terms of sustainability, we need to provide information for our government so that they are able to budget for these critical issues, and they are able to scale it from the national level down to the local government settings. Secondly, is two questions to Honorable Justice. First question is, has Ugandan government made structures to provide for free legal aid services for survivors of GBV and IPV for that matter, in the sense that is there a sustainability initiative to have law graduate students take up pro bono work as part of their legal practice before they start their practice, or after or during their practice? Because we've seen this as a challenge in Kenya, where if there's no NGO providing free legal services, and when there's no funding, what happens next? Do we have this kind of structures in place in Uganda, and what have you learned from it? The second question is, has the Ugandan justice system incorporated the use of a sexual offenders register? If yes, what has been the experience? If no, has it been considered, and how do you envision working on it as a method of preventing GBV and IPV for that matter? Thank you.
Well, thank you, everybody. We had many comments and a few questions in amongst them. I think all of the questions went to Sister Batema. So can you respond to those, and then we'll see what other comments people have.
I think I'll answer the shortest one, which needs really highlighting that it is important to look at what are those costs. You must ask the question, what are the specific costs that are required in addition to what the system already has? Because we're saying this is an area where previously we hadn't paid a lot of attention, and as we learn about what needs to be done for the survivors, then we learn what do we need to cost for. There is special equipment that you need. You will need to store, for instance, materials that you're collecting from the survivors, and you will not handle them just like any other. They need special environments. You'll need environments which provide privacy and confidentiality for these survivors of rape. I'm just mentioning a few. You need training, special training. Some of it can be integrated, some of it may not be integrated. For instance, when we call in our colleagues from the lawyers, from the police, I think even transporting them and making sure that they eat something to the various districts of the country, they will need resources. We need to ensure that the community programs for prevention, you have to go to the communities, get out of your comfortable zone, out of your health unit, to get out there, to make sure that you're talking to the communities that matter. Justice Batema may mention it, that the health workers, for instance, they need to be transported to the courts, and somebody has to take care of that cost. So there are various costs that you have to think about. Police forms and healthcare forms. We've now developed different forms, and we don't have these forms readily available, and so the women now instead have to buy them. And so we are saying, can the relevant government sector, internal affairs and justice, really ensure that these are forms which are readily available? Otherwise, if that is the starting point and they are not available, we can't record what is on you. That's a problem already. And they are not the normal medical form 5, where we put the records of the survivors. So I think as we continue to think about this program, and maybe that's why we never budgeted for it in the first place, but when you critically think about what are your needs to provide a service, ranging from training to the actual service provision, then you begin to see the costs in reality.
Okay, I'm just going to comment on the issue of also on the budget and what we actually do beyond the lip service, apart from the policies. Normally, when we have an important issue like this, we engage the member states at the country level through symposium. This symposium normally involve parliamentarians from the committees of health, finance, planning, ministries, the line ministries which are concerned with these issues, and we feel the best person to own these processes through funding is the government. And a number of governments have always responded. We have worked in Lesotho, we have worked in Swaziland, we have worked in Malawi, and we have seen budgets being increased for certain aspects of health. And so this is what we do beyond just making the policies. Thank you.
Thank you for the many questions and concerns. First, ignorance of the law. We know that ignorance of the law is no defense, but the Constitution as the grand norm, as the mother of all laws, must be translated in the various vernaculars. It is a must. The state is running away from this constitutional duty since 1995. And we shall not get tired. I'm happy there is another reverend there to preach that. My reverend in the village preaches every Sunday, although nobody gets saved. The lady from Care, yes, sexual offenses are capital. What the amendment has helped us to do is say defilement of girls below 14 years is aggravated. Girls above 14 is borderline. That one can be tried in the Chief Magistrate's courts. That one has helped us to clear a backlog of girls and boys at borderline or child-to-child defilement. A boy of 17 and a half with a girl of 15, those go to the Chief Magistrate's court and the procedure is simple. It is true, it's a backlog, but we are happy that the government has put in the political will and appointed a number of judges, unprecedented. I think last year and this year alone we have got 36 new judges, and that one will help. The target is 84 judges. I think we are now 56. If resources allow, yes. But there's no penalty for a magistrate or a judge delaying a case. There is judicial immunity so that you are able to deliver your judgment without fear or favor. If we were to penalize the magistrates and the judges, they would hurry justice or they would fear to deliver judgments. What is the cost of a trial, a case? Some people have tried to estimate. We are working on estimates of 40 million for 30 cases. I don't know the mathematics there. So sometimes the trial ends within 1 month. 40 cases or 1 month. But that depends if there are people pleading guilty. Where we have a culture of adversarial trial, you prove each and every ingredient. For example, you are saying somebody died and says, no, she didn't die. You prove that the person who died was Anna. So you go into that trial. Or you bring a child and somebody says, this is a child of 10 years, let's do a voir dire. Is she capable of telling the truth on oath? If not on oath, should we believe him or her? So that one you'll find that the 40 million will not be enough, where there are trials within a trial, or where one case file like this has got 20 or 50 defendants. Let's take a case of mob justice. Somebody steals a phone and is beaten to death, and they arrest all of you here and say you are all on that case. So each one will be entitled to bring a defense, but it is one file. So if you said 40 cases, 30 days, you haven't counted the number of suspects on a particular file. The actual cost of trial is yet to be determined, and we are saying the various actors, like the doctors, should have their own cost, the police should have their own cost, the prisons should have their cost. If one person is going to sit and plan for the doctors, it will be wrong. If the police officer is going to plan for the judge, it will be wrong. So that's why we have the justice, law, and order sector, such that we all fish from the one basket. If I was a representative of JELOS, maybe I would answer this question better. But I can only speak from one aspect of the judiciary and not JELOS. The budgets have been spoken about. When can they be translated into action? In the judiciary, we have had a problem of gender budgeting. And Danida Good Governance has done a lot to try and teach the judges gender budgeting. Now, the problem with the judges, I don't know whether you know that it's a problem. We are not supposed to bargain for funds. If we were to go and kneel down before Parliament, they would hold us at ransom, either on election petitions or what. So we sit back and say, you budget for us, and then they budget what they think is correct. When it goes to the president, he knows how best he cuts it. But the president and Minister of Finance are supposed to intervene directly, but not the judges to intervene and campaign for their budget. Law Society can do that on behalf of the judiciary, but it has its own problems too. Are we getting a critical mass of gender-sensitive judges? The definition of critical mass, you know, we are trained in the use of words. Words are our tools of work. When you say critical mass, out of 56 judges, what is a critical mass? All I know is that since 2000, we have got engendered judges who have made an about-turn about their judgments. Let me give you an example of Justice Lugaizi. He has since retired last year. One of his cases we used in training was Uganda versus Apai. A lady who was raped said, that man used me throughout the rainy night. He made me his wife. And the judge said, I don't understand. He made you his wife? Were you cooking? Were you ironing? So many questions. And so the woman said, my son, those are big words. They can't go through my mouth. And the judge said, I'm not your son. Call me his lordship. He said, okay, but you are the age of my son anyway. The fact is that you know these are big words. They can't go through my mouth. And the judge said, for lack of evidence, Apai is acquitted. Because we don't know what exactly happened inside that heart. But after this Batema training, Justice Lugaizi had another case, Uganda versus Matovu. And there was a requirement, prosecution argued for corroboration. In a sexual offense, women often tell lies. For one reason or another, they fabricate lies, which are easy to fabricate, but very hard to refute. That was the argument, and the judge said, there is no empirical data to show that women or men tell lies more than the other. The requirement of corroboration is discrimination based on sex, such that women come to the law courts on double standards. The victims are treated as suspects, as potential liars. And he rejected that corroboration and said it is her word against his word. And as for the doctor's evidence, it is advised. I can take it or reject it. I'm advised, and I've weighed the evidence. I'm taking the evidence of this girl. I'm convinced she was defiled. What an about turn. Compare that to Apai and Matovu. So we don't have a critical mass, but we are approaching it the Jesus way. The numbers may not matter. Just 12 disciples, and now we have billions of Christians, isn't it? So, if you have got 5 sisters on the bench, not necessarily women, but the sister Batemas, they can do a good job. And people are, for example, that case I passed of Uganda versus Kamuhanda, one of my senior judges wrote and said, Kamuhanda, accumulated anger, provocation, this kind of reasoning will lead to the extinction of mankind if the judge is going to listen to accumulated anger. And I said, you write your own judgment against, because for me I feel like gender is a critical turning point. Now that we have criminalized domestic violence, we can no longer say we should not consider the gendered inequalities in society. The criminal law principle of provocation should change. So there we are. But we think we shall have a critical mass with time. Some are changing internally. Others, as you can hear, they are. For lack of time, let me tell you that I earned the title of sisterhood in a workshop like this. One judge said, can I ask you a question, Miss Batema? And I said, I'm presenting as a consultant. He said, but you have talked a lot about sisterhood. And I said, Judge, if you are from Bugisu in the east, there to prove that you are a man, you unzip. Come forward, we both unzip. Because I'm feeling insulted. To talk about women's rights does not mean I'm less of a man. And it took the intervention of the Deputy Chief Justice for the workshop to continue. Otherwise, I closed it. ADR, working against women, yes. We have realized that very many judicial officers pretend to promote reconciliation. But they are gender insensitive. Fortunately, Justice Law and Order Sector has put out an advert. If some of you have seen it, please apply. We want to develop benchmarks in alternative dispute resolution where the matters are of a domestic nature. Because the gendered power relations are quite different from the normal, let's say, commercial, where MTN and the UTL are coming in for ADR. No. Here you are considering somebody who wants to keep quiet. Say, I will not talk. You are considering somebody who will say, how about the relatives of the perpetrator of the violence? What if my mother-in-law sends me away? You are talking about somebody who is paying the school fees and paying the rent, coming back with the kavera of food. Oh my God. So we are developing benchmarks so that the gender insensitivity of judicial officers is taken care of, because we have lost it somewhere in ADR. We have realized the problem. Please go to the Justice Law and Order Sector, apply, bid, and get that contract. Survivors of rape testifying in open court. Yes, they have been. And more so for the judges and magistrates who have not gone through this training. It also sends me to the other question. Is it being taken as a national policy? Are people being recruited and trained? The answer is no. Recently, we recruited 36 new magistrates. And I was waiting to be told you have got a gender sensitization program, gender training program. And they said, there's no money. We are taking them to Chankwanzi. Now they went to be trained in how to use a gun and self-defense and all that. That's very little to do with their bench work. So unless we institutionalize it and follow the judiciary gender policy, we shall continue having judges and magistrates who are producing gender-insensitive judgments, gender-insensitive procedure. Otherwise, the Magistrates Courts Act and the TIA provide for sexual offenses being heard in camera, and that's what I do. For example, they also provide for children's names and identity not being disclosed, but they are disclosed in the press nowadays. I see them. So and so raped a child, so and so in such and such a school, aged this. And say, what press? What is the press doing contrary to the law? So we need that. It is still a gap, and we shall continue training our magistrates and judges to hear cases in camera. Free legal aid, yes, we have got justice centers institutionalized within the judiciary, justice centers, but they are being piloted. Not every court has them. Just like Law Development Center is providing legal aid, and for every lawyer, I think is required to, she is required to do pro bono services and awarded marks every year, isn't it? Yes, so we are depending on that. I want to thank you for those questions.
Just before we close, Anna, did you have any comments or feedback?
A bit of reflection on how sustainability our program can be. I'm just thinking that Uganda and Kenya might have the same thing, the same programs. We depend on donors to fund our programs, but we have a huge job to work around the government and make sure that we're engaging our government to give us support in developing the social welfare workforce. So we're hoping maybe the regional collaborations between social workers in Tanzania and Uganda will work together and find a way of working together and making sure that what we do is sustainable. That's what I wanted to say.
Your takeaway package, sir. If you are able to see these films, they are good for gender training. The Convict, that one is by Batema. Sisters-in-Law, a group, Women Make Movies, Cameroon. Silent Culture, University of Zimbabwe with Batema. What is Love? I think that is Madonna. What's love got to do with it? The Burning Bed. There is also a UNICEF skit on FGM in Somalia. The Father of the Bride. Not Again. This is the police and the University of Zimbabwe. There is one called the Share with Rakai Health Science Program. Soul City. Neria. And then Sasa.
Okay, for the organizers, what do what time do you want to reconvene?
We're going to come back at
2:15 on the dot. Okay, thank you very much. Enjoy your lunch.
Thank you for moderating.